Hello, today we are going to learn an important topic, that is introduction to the forensic medicine. What is the definition of the forensic medicine? What is the meaning of word forensic? And in 2 years, as a second year M.B.B.S students, what things you are going to learn? So the first, we'll go to the basic. What is the meaning of word forensic? So you must have heard the word forensic medicine, community medicine, general medicine. But the question must come in your mind that why it is called as a forensic medicine. So the forensic word is derived from the Latin word forensis, that is F-O-R-E-N-S-I-S. Forensis. Forensis is a Latin word. It means that the platform where the legal matters used to discuss. This is the meaning of the word forensis. From this Latin word forensis, forensic word is derived. So the thing must come in your mind that this subject must deal with the legal matters. So I again repeat that the forensic word is derived from the word forensis, and which is Latin word, and the meaning of the forensis is the platform where legal matter used to discuss. Then we will proceed for the definition forensic medicine. Forensic medicine is defined as the application of scientific medical knowledge in a court of law for administration of the justice. So that is the book definition of the forensic medicine. I will divide this definition into 3 parts. First part, application of scientific medical knowledge. Where it is applied? In court of law. For what purpose? For the dispensation of the justice. So again I will repeat the definition of the forensic medicine. Definition of the forensic medicine is application of scientific medical knowledge in a court of law for administration of justice. What are the 3 parts of this definition? First part is the application. What is applied? Scientific medical knowledge. Where it is applied? In court of law. For what purpose it is applied? For administration of the justice. So again I will repeat, the forensic medicine is defined as application of scientific medical knowledge in a court of law for administration of justice. For the understanding purpose, I will again repeat what is applied? Scientific medical knowledge. Where it is applied? In a court of law. For what purpose it is applied? For administration of the justice. So you need not mug up this definition. You understand. If you understand the thing, then you will lifetime you will never forget it. So what is the definition of the forensic medicine? Forensic medicine is defined as application of scientific medical knowledge in a court of law for administration of justice. And this is the first definition each examiner asks. So this is the proper definition or book definition of the forensic medicine. Then I will proceed for the next important definition, that is what is medical jurisprudence. Medical jurisprudence is defined as legal aspect of practice of medicine. Now you must think both are same, but listen carefully. I am again repeating the definition of the forensic medicine. Definition of the forensic medicine is the application of scientific medical knowledge in a court of law for the administration of justice. And what is the definition of medical jurisprudence? Definition of the medical jurisprudence is the legal aspect of practice of medicine. So I'll explain the difference between the definition of forensic medicine and definition of the medical jurisprudence. In forensic medicine, what is applied? Scientific medical knowledge. While in a medical jurisprudence, what is applied? That is the legal knowledge. So now you will understand the basic difference of the forensic medicine and the legal medicine. So in forensic medicine, what knowledge is applied? Scientific medical knowledge. Where it is applied? In a court of law. For what? For administration of justice. While in legal medicine, while in medical jurisprudence, what is applied? That is the legal knowledge. Where it is applied? In practice of medicine. So in forensic medicine, scientific medical knowledge is applied. While in medical jurisprudence, legal knowledge is applied in a medical practice. So that is the basic difference between forensic medicine and medical jurisprudence. So medical jurisprudence is one of the part of the forensic medicine. Have got the difference between the definition of the forensic medicine and the medical jurisprudence. Now I will proceed the next thing. So these two definitions are very important, and your conceptual clearance about the forensic medicine and the medical jurisprudence must be there. Now you are in a M.B.B.S curriculum is now competency based medical curriculum, that is the C.B.M.E. and there are many changes occurred, and my subject, that is the forensic medicine subject, is now going to be in a second year. Previously it is called as a second year M.B.B.S. Now it is called as a phase 3. So there are 4 phases. Phase 1, that is the first year M.B.B.S. Phase 2, that is the second year M.B.B.S. Phase 3, previously called as the third M.B.B.S. minor, and phase 4, previously called as a final M.B.B.S. Now my subject you are going to learn in a 2 years, that is in a phase 2 and in phase 3 part 1. So the university examination of my subject will be along with ENT, ophthalm, community medicine, and the 4th subject is of forensic medicine. Previously, forensic medicine, the final examination was in second year, that is along with pharmacology, pathology, microbiology. But in competency-based medical curriculum, forensic medicine will be going to taught in phase 2 and phase 3 part 1, and your final examination will be at the end of phase 3 part 1, that is along with ENT, ophthalm, community medicine, and the 4th subject is the forensic medicine. In total these 2 years, the NMC has allotted us 125 teaching hours. Out of this 125 teaching hours, 50 hours are allotted at a phase 2 and 75 hours are allotted at the phase 3 part 1. So in a first, that is in the second phase, that in a second year, 50 hours and 50 hours are divided into, like there are only 15 lectures, 25 small group teaching or practical or tutorial, and 5 are the SDL. SDL means self-directed learning. So in a phase 2, that is in a second year M.B.B.S, only 50 hours, and these 50 hours, out of that 15 are lectures, 25 are small group teaching, practical, tutorial, etc., and 5 are the self-directed learning. So these are the 50, and in the phase 2, that is phase 2 part 1, that 75 75 teaching hours are there. Out of that, 25 were lectures, 5 are SDL, and remaining 45 are the small group teaching, tutorial or practical. So total 125 hours are given. So in a second year, 50 hours, 15 hour for lecture, that is 15 lectures are there for the lectures, 30 hours for the small group teaching, and 5 are self-directed learning. In phase 3 and part 1, 75 hours total for forensic medicine. Out of that, 25 hours for lectures, 45 hours for small group teaching or tutorial, practical, and 5 for self-directed learning. Now you must have got the idea how this forensic medicine subject is going to be taught in phase 2 and phase 3 part 1. So what are the different topics are included in a forensic medicine subject? Now in a competency based medical education, these are the different competencies are there. And you are not going to learn this topic only in a forensic related but the integrated manner. So some topics are integrated with anatomy, some topics are integrated with surgery like injury or orthopedic, or for like some female examination or the gynec like sexual offenses cases. So all we are going to in integrated manner, we are going to teach that topic so that your concepts will get clear. So up till now, you must have cleared in your mind that my subject are dealing with a legal aspect. So you have to apply your scientific medical knowledge in a court of law for administration of justice. So it's a very, very important subject, because if there is law and order in a society is there, then and then only we can live happily. And when law and order will be is the best, when there is the proper justice. And as a medical person, we are going to help for the proper justice by applying our scientific medical knowledge in a court of law for administration of justice. So that's the importance of forensic medicine. So what are the different topics you are going to learn during this 2 years? First, that is court procedure. What are different courts are in India? What are their power? Like what is the district court? What is session court? What is high court? What is Supreme Court? What are their powers? Then how as a doctor you are going to give evidence in a court of law? What are different types of evidences? What are different types of witness? What is common witness? What is expert witness? What is hostile witness? What are different laws related to the doctor? Then what is IEC, that Indian Evidence Act? What is CRPC, that is Criminal Procedure Code? Then what is IPC, that is Indian Penal Code? So different, that in a first chapter you are going to learn. Second chapter, identity. How the person is identified. What are from his body examining? What are different body marks? If only skeleton are there, then how you are going to provide information to police officer from the skeleton? Is it of male? Is it of female? What must be the age? What is proper cause of death? Like that. That is the identity chapter. What is DNA fingerprinting? What is superimposition? All these things you are going to learn in identity chapter. Then death. Third important chapter. What are types of death? What are modes of death? What manner of death? Then as a medical expert, how you are going to diagnose that? Is it suicide? Is it homicide? Is it accident? Like that. Then what are the changes after the death? What are immediate changes? What are early changes? What are late changes? All information. From seeing the dead body, you are going to give information to what time since death. So from time since death, the police officer gets clue and he may reach to the accused. So that's the important topic, that death. Then injury. What are different types of injury? What are abrasion, contusion, laceration, incise wound, stab wound, firearm wound, and what are their typical features? How you are going to write the injury report, what is simple injury, what is grievous injury, what the effect that you are writing that is the grievous injury, then that person or that accused can go under bar for 7 years or up to life imprisonment, and it's on your report. And when you are confidently able to give that correct report, when your concepts are clear, when you are able to differentiate, is it simple injury or is it grievous injury? When you are writing that is the grievous injury, then that person go under bar for life imprisonment. So it's on your report. So your concept must be clear. And when your concept must be clear, you should learn, listen, whatever the lectures, and also study at your hostel or at home and get conceptually clear. Then you must be confident. And what happens after M.B.B.S? You are not confident to go to the court. You get tension how you are going to give evidence in a court of law. But as a my student, if you are going to learn all these things in a second year or in a phase 3 part 1, all these your concept will be clear. You must follow what pattern of mind, that you have to listen carefully the lecture, and at that day only you have to read that topic. If you will do or you will follow this my method, your 100% your concept will get clear. The next topic will that autopsy. What are the different types of the postmortem examination? How the postmortem examination should be carried out? What are different viscera? How the viscera are preserved? For where the viscera is sent for chemical analysis, where viscera is sent for histopathology, that is another chapter. Then there is forensic psychiatry. That is what are different types of illusions, delusions. Then what are the criminal responsibility of mentally ill person? What is civil responsibility of mentally ill person? What is McNaughton rule? What is 84 IPC? All these things you are going to learn in forensic psychiatry. Next important topic is the medical jurisprudence. I have already told what is the medical jurisprudence. It is a legal aspect of the practice of medicine. What are different laws related to the doctor? What is Consumer Protection Act? What is Preconceptual and Prenatal Diagnostic Test Act? That you should not divulge the sex of a fetus. Then what are different types of the MTP Act? Then Organ Transplantation Act. All these type of the acts you are going to learn. Then what are the functions of the, previously it is called a MCI, now it is the NMC. How it is, what is its constitution? Then what are state medical council? What are the functions of state medical council? What are the functions of the Medical Council of India, or now it is called as a National Medical Commission? Then what are the rights of doctor? What are duties of the doctor? What is professional misconduct? That is, professional misconduct is defined as any act done by a medical practitioner during pursuit of his practice, which is regarded as disgraceful and dishonorable by the professional breather of a good repute and competence. So there are different parameters which are called as a professional misconduct. What is medical negligence? That the medical professional should do the things where he has to do. And what is negligence? It is not doing the things where he has to do and doing the things that he should not do. That is the act of omission and act of commission. That is negligence. What is therapeutic misadventure? What is vicarious responsibility? What is actus novus intervenus? So all these things you are going to learn in a medical jurisprudence. What is res ipsa locutor? All these small things you are going to learn in a medical jurisprudence. Next important topic is that of the sexual offenses. What is virginity? What is defloration? What is pregnancy? What is delivery? What is infanticide? Then what are different types of sexual offenses? What are natural sexual offenses? What are unnatural sexual offenses? How you are going to examine the sexual offenses victim? How you are going to examine sexual offenses accused? And how you are going to give the report? So all these things you are going to learn in the sexual jurisprudence. And the important last topic, the subject name is forensic medicine and toxicology. So the toxicology, what is toxicology? Toxicology is the science which deals with the signs, symptoms of the poison, its treatment, with its medico-legal importance. So all these things, all different poisons, you are going to learn that the information about each poison, its signs, its symptoms, its fatal dose, its fatal period, its treatment, its medico-legal importance. So all these things you are going to learn that in a toxicology. So poison, water is also poison. If anything in excess you take in a body, that becomes a poison. What is drug? What is drug addiction? What are acts related to the drug addiction? All the important things you are going to learn in a toxicology. So this is the all broad concept I am telling you about my subject, that is the forensic medicine. Again, I will repeat or summarize my lecture. This is the introductory lecture about the forensic medicine and toxicology subject. Forensic medicine and toxicology subject you are going to learn under competency-based medical curriculum in 2 years. That is phase 2, means second year M.B.B.S, and phase 2 part 1, that is third year, first year. So in these total 125 hours, 50 hours in phase 2 and 75 hours in phase 3. Definition of the forensic medicine is application of scientific medical knowledge in a court of law for administration of the justice. Definition of medical jurisprudence is the legal aspect of practice of medicine. And during these 2 years, you are going to learn about court procedure, identity, date and its changes, autopsy, forensic psychiatry, medical jurisprudence, toxicology. So I think with this my introductory lecture, your concept must have clear. Thank you for patience hearing. Thank you very much.